Hi, welcome to section 3. So this is about the muscles that move your hips, your thighs, your lower legs, and even your feet. So, okay, let me move this down a little bit here on our little muscle model here. So the first couple of muscles on the list, the first two actually are deep muscles, and they're deep muscles associated with the coxa, so the pubic bone. And unfortunately, the muscle model does not have any skeleton that we can look at. But it would be underneath the rectus abdominis and the transverse abdominis. So these two muscles, the psoas major and the iliacus, are deep. Now, the psoas is that one with a P. So the P is silent, okay? There's a psoas minor as well, but we're just going to focus on the psoas major. So the psoas major is a muscle that runs from the vertebral column down to the leg. And its job is to flex the thigh at the hip. The iliacus is actually a muscle that sits in the ilium of the coxa. That's that big flare of the coxa. Like if you put your hands on your hips, you're putting your hands on top of the ilium. So there's a little flat muscle called the iliacus that sits right there. It also flexes the thigh at the hip. Okay, so let me see if I can do this. I'm going to try to kind of back away. And we'll take a look at what that is and see. I'm going to have to move this down lower like that. Okay, so these are your hips. So the psoas major is a deep abdominal muscle leading to the leg. And the iliacus is a deep muscle on top of the ilium of the hip. And the flexion of the thigh at the hip is here, at this joint right here. And so that is flexion, decreasing that angle. And when, of course, you can do it out straight. Oh, I'm going to fall over. I'm too old to do that. So when would you use this? Every single time you walk, every single time you get up out of a chair, every time you jog, play a sport, whatever it might be, you're using those two muscles. The next thing on your list are the quadriceps. Now, the quadricep muscles is actually a group of 4, and you don't have to know them individually. They're 4 muscles that run along the anterior portion of the thigh, and there's actually one that's a little deeper that you can't quite see as well here. And we just need to know it as a group called the quadriceps, quad for 4. The quadriceps action is to extend the leg at the knee. So now we're going to focus at the knee joint. And just by standing up, I'm actually using my quad. So this would be flexing at the knee. This is extension at the knee. So anytime you push down when you're walking or you're riding a bike or you're jogging, anytime that you're pushing down and you're extending at your knee, you're using your quad muscles, your quadriceps. The tensor fasciae latae, latae is for lateral. This is a lateral muscle on the thigh. It's covered up a little bit here by an aponeurosis, that flat sheet of connective tissue. And the tensor fasciae latae, they're your abductor muscles at the hip. So it abducts your thigh at the hip, and it also rotates the thigh medially. So again, this is the hip joint here. So it abducts the thigh at the hip and it rotates the thigh medially. So medial is inward. So anytime you're moving your leg inward, you're cutting across the soccer field or the field hockey field, or you're doing a little dance. I know it's pretty pathetic. Nobody wants to see that, Ms. Frincelli. You are turning that thigh inward. You're rotating it medially. Okay? So it abducts and rotates medially. Then we have the gracilis. And the gracilis is, I like to remember it starts with a G. It's the groin muscle. So there is a thin band muscle here in the groin. That is the gracilis muscle. It's much easier to see on this side of the model because of the stance that the model's taking. That's the gracilis. And the gracilis is an adductor of the thigh at the hip. It also is a synergist to flexing the leg at the knee. So it's this inside groin muscle, and it's an adductor. So remember, abduction is out. We were just doing with the tensor fasciae latae. This is an adductor. So this brings your leg back towards the center of the body. So you might use this if you're kicking a soccer ball, or if you're kicking somebody in the leg. Hopefully you'll never do that. That's very mean. You wouldn't do that. So that is your adductor, ADD. The sartorius muscle is a strap-like muscle that is diagonal across the thigh. This strap-like muscle that's diagonal across the thigh. This is an abductor muscle, a lot like the tensor fasciae latae, so it's a synergist to abducting, but it rotates the thigh laterally. It also helps to flex the leg at the hip and the knee. So it does quite a few things because of its anatomical positioning. So let's think about this. So this is a muscle that goes from outside in on both sides of your leg. And it abducts. So again, that's going out to the side, abducting, or out from center. It rotates the thigh laterally. Laterally is out away. This was medially, which the tensor fasciae latae does. The sartorius does it laterally. So when you're ice skating, or again, dancing, it's kind of bad, isn't it? Sorry. Or skiing, right? Anyone? Okay. Then you're using both your tensor fasciae latae for medial and your sartorius for that lateral rotation, moving it out. It's a synergist for flexing the leg at the hip and the knee. So it helps with these two motions here. I'm flexing at the hip and I'm flexing at the knee. It's a helper to do that. All right, posteriorly, you got the gluteus maximus. There's actually three glute muscles. There's a gluteus maximus, medius, and minus. We're only going to focus on the gluteus maximus. It's the most superficial. This extends the thigh at the hip. So this is also an extender, but it does it at the hip, where the quads extend at the knee. The gluteus maximus extends at the hip. So if you're sitting down in your chair right now, oh my God, I'm going to try to do a sit without being in a chair. I'm going to fall. Call 911. Oh, it's a video. Never mind. So if you're sitting in your chair, when you stand up, of course, you're going to use your quads to extend at your knees, but you're also using your glutes to extend at your hips. So the extension for the glutes is this joint here at the hips. So if you do a lot of squats at the gym, you're working your quads and you're working your glutes. Okay. The biceps femoris is part of the hamstring muscle. There's actually two muscles here, the biceps femoris and the semitendinous, and they both make up what we commonly call the hamstring. So it's a posterior muscle. Notice that it's called bicep. That means two heads. And unlike the bicep brachii, which is up here in the arm, in the front, it's called that because it's in the brachial region. The biceps femoris is in the femoral region of the body. So it's named biceps femoris, femoral. Right? It all connects. Sometimes, not all the times in anatomy. Sometimes it's quite messy. So what the bicep femoris does is it flexes the leg at the knee, and it also helps to rotate the leg laterally at the knee, like the sartorius. Okay, and so if you were going to work your hamstrings, every time, so the hamstrings are in the back here, every time you flex your leg at the knee, you're working your hamstring. Okay, when do you do that? Oh, you do it when you run. You do it when you walk upstairs. You do it when you're just walking like a normal person, which I'm not really walking very normally. I don't look so weird. Okay. The last three are all part of the lower leg. So I'm going to ask you guys to, even if you're sitting, to do the actions. It's better if you stand. if you want to do the actions, but you can also do it sitting. So anteriorly, on what you might call your shin, is the tibialis anterior. So it sits on the tibia and it's in the front. So tibialis anterior. This dorsiflexes your foot and inverts the foot. So if you literally do that, I don't know if you can see my feet, but if you just point your toes up to the sky, you do that for a minute, you should feel a lot of tension right here in this muscle. That is your tibialis anterior. And then if you take your foot like this and you invert it, you'll still feel that tension. Do you walk around like this? No. But again, it might help you like to kick a ball if you're a soccer player. It might help if you're like a dancer and you do some kind of moves like that. And it actually helps in just regular walking and running. You dorsiflex and you invert your foot. The gastrocnemius is also a lower leg muscle, but it is posterior. And that is what you might commonly call your calf muscle here. So just to back it up so you can see where we are in the muscle person, we're down here, the lower leg posteriorly. This is the gastrocnemius. It's attached to the calcaneus bone by the calcaneus tendon. This is also called the Achilles tendon, based on the myth about Achilles who got an arrow here and whatever. I digress. The function or action of the gastrocnemius is plantar flexion, and it assists with flexion of the leg at the knee. So again, plantar flexion is pointing your toes on the ground. So all you have to do is stand up, stand on your toes. You just do that for a moment, and you're going to feel the tension in this back leg muscle here, that's your gastrocnemius. It also helps to assist with flexing your leg at your knee. And last but not least is the soleus muscle. And the soleus muscle is also better seen posteriorly and a little laterally. It pouches out from the gastrocnemius. This person has such a huge gastrocnemius, it's a little hard to see, but when you look on your labeling activities, it'll pouch out to the sides, and you'll be able to see it a little better down here on either side of this big tendon. And this is a synergist to plantar flexion. So when you stand up on your toes, you're working both your gastrocnemius and you're working your soleus muscle. So those are your muscles in the third section. I hope that you do the actions and you practice. And thank you guys for listening. Oh, I never turned on the thing. I did turn